Yes.
Perfect. Good evening. My name is Amrit Hinduja. Uh, I represent the Swedish Trade Commissioner's Office and also co-leading the India-Sweden Healthcare Innovation Center. It's a great pleasure to have all of you. We were just discussing as we were waiting to start the meeting that despite all what has happened this year and all the quite unexpected turns the world has taken within healthcare. It's really great that today we are able to, in some ways, rejoin to celebrate and start some tangible activities with this collaboration that we started. And this evening marks very much that. So thank you all for joining. To start this evening, I'd like to invite Mr. Anders Wickberg, Swedish Trade Commissioner to India, to say a few opening remarks.
Thank you, Amrit, and good evening, everyone, or good afternoon for those of you in Sweden. And thanks for joining this virtual kickoff. It's indeed, like you say, Amrit, a great day for all of us who has been involved during the last 9 months in making this happen. And I think little did we know when we inked this collaboration during the state visit in early December that the turns the world would take since, which would also, of course, impact the implementation of the center. But I think also little could we anticipate how important this center has the potential to be for the health challenges both now and in the future. So indeed a great day, and thank you everyone for participating. This collaboration, as you know, of the physical center is yet another milestone in the India-Sweden relations, which building upon the now more than 10-year-old MOU in healthcare, but also the innovation partnership inked in 2018 between our two prime ministers. So it means that we are again seeing another very concrete and tangible step in the further relationship. I just want to mention a few of the key collaborators and persons and institutes who have made this happen. Of course, our key collaborators within AIIMS Delhi, Dr. Randeep Guleria, AIIMS Jodhpur, Dr. Sanjay Mishra, for your great support in making this happen. Of course, from ICMR, Dr. Baran Bhargav for the strategic guidance, as well as from the Ministry of Health and Family Welfare, Secretary Rajesh Bhusha for the overall guidance. Also, thank you for all the significant partners, and I know later in this call we will unveil even more collaborations with Invest India, Atal Innovation Mission, and NASCOM. And last but not least, also thank you to our key knowledge partner, AstraZeneca, and Managing Director Gagan Singh for your global expertise in also supporting this effort. I'm sure that this innovation center will bring together the most talented minds, bright ideas, and breakthrough innovations from both India and Sweden under one physical roof. And it will benefit not only our respective countries in the future, but hopefully also the world. So thanks again, everyone, for participating. And I hand over to you again, Amrit.
Thank you, Anders. Thank you for joining us from Sweden this afternoon. I'd like to invite an important one more partner from Sweden, the Ministry of Health and Social Affairs, represented today by Mr. Nicholas Jacobsen, who's also the co-chair to the joint working group of the India-Sweden MOU. Nicholas, would be great for you to address the gathering today.
Thank you very much, Amrit, and a very good evening to all of you. It's really nice to see all of you, or hear all of you here tonight. Last year, we happily celebrated the 10 years completion of the India-Sweden Health MOU. And as you know, remember, it culminated during the royal state visit to India in December. And since then, of course, a lot of things have happened, not all very good. But now we look forward to the next decade of our cooperation, which has started now from 2020. Just a couple of weeks ago, our health ministers had a telephone conversation where both deeply appreciated the health cooperation and they also encouraged this to deepen, or all of us to deepen the ties between the countries. Of course, the minister spoke about the global pandemic and how cross-country collaboration, how important it really is today to enhance this collaboration in order to jointly fight this pandemic and the other challenges in the new world. And I think that this event today is very special in this context. We during the state visit, we signed the MOI for the India-Sweden Healthcare Cooperation in presence by the Swedish State Secretary and the both of the Indian health ministers back in December. And since then, the collaborators have set the wheels in motion in the right direction. And of course, this we will hear much more about later. And today we come together to more tangibly launch initiatives under this, and we look forward to picking the fruits of this hard work in the area of health innovation. I would also like to take this opportunity to congratulate the new Health Secretary, Mr. Rajesh Bhushan, and I'm glad that we are meeting virtually, and I look forward to meeting you in person in the future. I do hope that we soon will be able to hold a joint working group and we'll hopefully start planning for this in the near future. So thank you very much, and back to you, Amrit.
Thank you. Thank you, Nicholas, for highlighting the journey so far between India and Sweden in the health cooperation and how we plan to strengthen it. For the India-Sweden Healthcare Innovation Center to be effective, we have set up a secretariat that works continuously towards creating tangible milestones in this collaboration. And this is guided by a few leaders in this forum. And I would now like to invite Dr. Kuldeep, Dean Academics, AIIMS Jodhpur, Dr. Pankaj, Vice Dean Research, and my colleague Shubhang, who's co-leading the Innovation Center, to spend a few minutes to present the status of the India-Sweden Healthcare Innovation Center and the journey so far.
Thank you so much, Amrit, and good evening, everyone. Thank you so much for joining in. As we move along towards the Innovation Challenge launch and the launch of the website as well, we would like to take this opportunity to walk through some of the building blocks of this particular India-Sweden Healthcare Innovation Center. Also look at the offerings that we're providing to all stakeholders, including the entrepreneurs and innovators. Take stock of some of the activities that we have completed since the signing last December, and also look as to what's next in the pipeline for us. So taking a look at what's the next steps, at least till the end of the year. We have been calling this India in Sweden Innovation Center as a center, but we are striving very hard to actually create a holistic innovation ecosystem, which will not only be a platform to help entrepreneurs ideate, develop, and test solutions, but we envision this to be a platform that will help drive and that will help enable with our esteemed partners across the board to scale up the solutions across the healthcare delivery network of India. This holistic nature of the Innovation Center, as opposed to solving something in a very siloed fashion, is something that we are looking to be a huge differentiator when we have these innovators come on board and kind of work with us over the next couple of years. Now, if we see as to how the Innovation Center is built, it is based on 4 main pillars. The first one of them is protocols and processes, how we can make the current protocols and processes across the patient life cycle more efficient, more effective, so that we can better administer awareness, screening, rehabilitation, and diagnosis, and other such phases of the entire patient life cycle, if you will. Second is technology. How do we best use emerging, or they're not so emerging right now, they're already mainstream, like artificial intelligence, machine learning, deep learning, telemedicine protocols, uh, including development and improvement of existing point of care devices so that it has a very positive impact for all the patients in selected therapy areas. Third is business models. The main goal here is how do we lessen the burden, the cost burden of on the patient and on the entire healthcare machinery, both government and private. Like, what are some of the how we can reimagine those business models to make sure that the burden is really reduced for the last man on the line, to the common man. And in this, we would like to obviously call out something that, which is being done through Ayushman Bharat, but we are committed to that program, and we can see as to how we can provide our inputs and insights to that. Fourth, and very importantly, is data. How do we best use data, process data, and disseminate data with the right regulations and the right protocols, so that we can again, kind of make sure that the protocols, the point of care devices, the technology and business models are much more effective than what are they today. We feel this particular approach, would give us the best chance, the best probability of success in the near and the longer term. If we can go to the offerings slide. And to operationalize such a center or an ecosystem, we have developed these 9 offerings or so. The first is incubation. We are creating a state-of-the-art incubation center within the AIIMS Jodhpur campus. Plus, we'll also have a satellite center within the NASSCOM premises in Bangalore. Second is mentorship. We are getting on board renowned and leaders in academia, industry, business, and so on and so forth, and government agencies to come together and help provide the right kind of guidance to innovators who would be onboarded. Third is funding, enabling access to both government funding and grants, and even private fundings and investors who would be interested in looking or kind of in making sure that such successes that come out of the center are scaled up across the country and probably the globe. That goes to global reach. Although this particular innovation center or ecosystem, we are starting in India, but we are tying up with institutions and innovation hubs in Sweden as well to start off with for better ideation. And also, once a particular solution is deemed to be ready for scaling up, we would also help these particular entrepreneurs, use our resources to scale up in India, Europe, or around the world as well. Life Center of Excellence, it's very interesting. It's creation of a model clinic where you can showcase, where you can test, where you can pilot best-in-class products, protocols, processes, etc. For 1 or 2 selected therapy areas. And we are setting up this Life Center of Excellence again at the AIIMS Jodhpur hospital campus. Skill for scale, we feel innovation by itself is not the end all or the end game. Basically, we need to make sure that anything which is innovated upon is provided, or the medical practitioners are trained on that. So we have created a Skill for Scale program, the curriculums of which would be developed jointly with our collaborators and our strategic partners on the Governing Council. The next is digital showcase or showcase. We are giving opportunities to showcase across the network of solutions which will be selected by an esteemed panel, to kind of audiences across the world. The next is Think Tank. This is about publishing business white papers, not necessarily medical white papers, but business white papers explaining as to why have we selected a particular focus area or why a particular innovative solution is extremely important for the healthcare delivery system in India, Sweden, and beyond. And last but not the least is conferences, a platform for all the stakeholders, including all our partners from this forum, to come together with many more and also for entrepreneurs to get a live experience of showcasing their solutions and connecting with the absolutely right stakeholders. So we ensure that anything which is developed does not remain in a silo, but actually scales up in the right fashion. Now, I would like to call upon Dr. Kuldeep, Dean Academics and HOD Pediatrics from AIIMS Jodhpur, to give us an update on the activities done so far, sir. Over to you, Dr. Kuldeep.
Thank you, Mr. Shubham and Mr. Amrit, and Honorable Chief Guest, Mr. Rajesh Bhushan, and all the dignitaries present in this launch. Thank you for Shubham for introduction of this Innovation Center at AIIMS Jodhpur. So till now, what is the status of this is that there's a MOI was signed in December 2019. After that, we started on the work and a governing council was set up, and there was a planning of the meetings for the governing council. We also governing council meeting was delayed because of the COVID. Although COVID was created a lot of challenges also, but also had presented a lot of opportunities for the innovation as well. In the meantime, we had identified the incubation place at our center at AIIMS Jodhpur, and we had taken mentors from AIIMS Jodhpur and IIT Jodhpur on board. We had multiple discussions with the team from Sweden, along with the AstraZeneca, and we had narrowed down some of the therapeutics for the live COA, and these are being further developed. And we have also identified the funding partners. And as Dr. Shubham, as Mr. Shubham has said, that there are funding partners from many places. There are 30 outreach partners. There are 3 deep technology ecosystem partners, including the Atal Innovation Mission. And we have AstraZeneca as the funding partner from Sweden. And the next is that we have the Innovation Challenge launch, which is going to happen today. And I think this is a very privileged time for AIIMS Jodhpur to be a part of this India-Sweden business innovation, and also a part of this innovation center, tripartite agreement with the AIIMS Delhi. So we are looking forward for further development in this area. Now I invite Dr. Pankaj Bharadwaj to tell about what are the next steps.
Thank you, Professor Singh, and thank you all the partners for taking us on board today. So as very well mentioned by our Dean from All India Institute of Medical Sciences, Jodhpur, that we have reached to this point where in the month of August, we all are here with the dignitaries on board and with the Innovation Challenge launch. So from here onward, as we are on the mid of this third quarter of year, we have 2 major milestones which we are looking forward. And this is, first one is the this evaluation panel, which is going to evaluate the innovation challenges which we are going to get after this launch is over. And we have applicants and we have different partners who have applied for this innovation challenge. The second very important activity which we are looking forward in this third quarter is onboard global reach partners. As Shubhang and Amrit has already mentioned, that the discussions are ongoing with the rest of the universities. Few to mention as Umeå University, innovation hubs in Sweden, and bioventure hubs, but these are not just a few of them. The discussions are going on, and we are hoping to have them in this third quarter of the year. In the fourth quarter of the year, we have a few major milestones, which we are very hopeful of getting them as very well noted in our earlier discussions, where Business Sweden and AIIMS Jodhpur, along with AIIMS Delhi team, keeping timeliness very properly. So we are hoping to have these announcement of the winners and launch of incubation center, which Shubhang has already mentioned that it would be there physically in All India Institute of Medical Sciences, Jodhpur. So we would also be looking forward in the fourth quarter of having onboard startups and these providing these mentorships and funding access. As in all those activities which Shubhang has mentioned, the very important one, which is also the launch of Live Center of Excellence, We are already in discussion with the team of Business Sweden, and the two areas which AIIMS Jodhpur has come up are, to begin with, is in field of oncology and cardio-reno-metabolic disorders. So we are hoping, and we are very much hopeful that with all these challenges which currently the entire world is going through, we would be able to keep all these timelines. Thank you so much, and over to Shubhang and Amrit.
Yeah, thank you, Dr. Pankaj, Dr. Kuldeep, and Shubhang. Uh, the Ministry of Health in India have played a very important role always to support and encourage both partners on both sides to set high visions. In particular, there are two pillars in the ministry who have always enthusiased us and always promoted us to think big and to think with tangible, impactful deliverables. That is both Joint Secretary Mr. Love Agarwal and Joint Secretary Sunil Sharma. We are very thankful for your guidance, sir. And I'd like to invite both of them on screen here to today launch and kind of bring on board three new partners to the India-Sweden healthcare innovation ecosystem. Could we have the video of both Dr. Love, Mr. Love Agarwal and Mr. Sunil Sharma on screen, please? And sirs, I would request you to kindly do the honors of releasing the partnership documents that are in front of you. These are partnerships with Invest India, Atal Innovation Mission, and NASSCOM. I think your video is off, sir. May I request you to kindly switch on the video at the Ministry of Health?
Amrit, our video is on. I think.
Okay. Yes, now we can see you, sir. Thank you.
But in the presence of respected secretary, sir,
yes,
we do sort of unveil this document.
Thank you.
Thank you.
I now request Mr. Deepak Bagla, MD and CEO Invest India, to say a few words.
Thank you, Amrit. It's truly a special evening, and why I say it is a special evening for us in India, an afternoon for our friends in Sweden, because this is a very special relationship. And thank you for giving Invest India the opportunity of partnering in this very important initiative. And I'll tell you why I say it is an important initiative. In 2018, we launched the Startup Bridge with Sweden. You know, the Honorable Prime Minister was there. We did that. And it's become a very robust bridge. In fact, just last year, we sent 10 of our startups to Sweden, and they were hosted very well. And there are a number of challenges which are happening on this bridge very actively. And a large number of them are being sponsored by corporates. But the reason why I say that this is a very critical part today is because health is one of the strongest pillars of this corridor. And today we are seeing a concrete development happening there. So I do want to just ensure and to let you know from our side, Shubhang, that you will have complete support from Invest India. You know, you were talking of your global outreach. We already have bridges with 10 countries, which are extremely active, which is also finding out new, very successful ideas and startups which are there. We also have the entire Agni program, the Accelerated Growth of New India Innovation, which is run by the Principal Scientific Advisor to the Prime Minister. And that program is also executed by Invest India, where we are picking up these successful startups, these amazing ideas, and taking them on to commercialization. And that's, again, where you play a very critical role, where we can bring them on to you. So I do want to say that it is a very important partnership. What you are doing, the center is going to play a very, very critical role. We are there to be with you, to support you in every moment. And before I end, I have to thank especially our friends from Business Sweden and the entire business community of Sweden. They supported us in a very close manner right through these 141 days of the most unprecedented lockdown in human history. They worked with our team, even providing PPEs and coming up with solutions at every stage. This relationship was the one which carried it forward and made it strong. And I look forward to further strengthening this with this very strong pillar which is coming up today. Thank you again on behalf of Invest India to give us this opportunity. Thank you.
Thank you, Mr. Bagla. I now invite Mr. Ramanan, Mission Director, Atal Innovation Mission, and the second important partner we are bringing on board today. Sir, request you to say a few words.
Yeah, thank you, and respected Mr. Anders Wigberg, Swedish Trade Commissioner to India, respected Joint Secretaries Mr. Lab Agarwal and Mr. Sunil Sharma, respected Balram Bhargav, Dr. Balram Bhargav, Dr. Randeep Guleria, Dr. Sanjeev Mishra, and Honorable Secretary Mr. Rajesh Bhushan. It is indeed a pleasure and privilege for us to be associated with the launch of this very important event, the India-Sweden Healthcare Innovation Center and the Innovation Challenge. Atal Innovation Mission, as most of you are aware, is a flagship initiative of the Niti Aayog, the think tank of the country, in order to create and promote an ecosystem of innovation and entrepreneurship across the length and breadth of our country. And in this, the Swedish embassy, the Swedish government has been a very strong partner over the last 2.5 years in a number of initiatives that the Atal Innovation Mission has launched together with them, whether it be for the Atal Tinkering Labs at the school level with Nobel Sweden, whether it is with Trade Business Sweden on the Unnati challenges that we launch in the healthcare community, or in the new areas that we are looking forward to working with you. The Atal Innovation Mission's value that we would like to bring to this relationship is the network of incubators and startups that is being built across the country. More than 102 incubators have been launched over the last couple of years. More than 1,500 startups are operational through this network, and more than 547 of them are women-led startups. The other important thing is we are setting up Atal Community Innovation Centers across the country, and innovation challenges and innovations created in this center is going to be very useful in being implemented in the community innovation centers across the country, which are particularly being set up in rural India, tier 2, tier 3 cities, in the unserved, underserved regions of our country, because it is there where the maximum requirement is present for healthcare to make an impact. We have 115 of 715 districts of our country as aspirational districts, where you still have very poor access to healthcare, education, drinking water, sanitation, basic hygiene, and so on. And we still have problems of 1 in 3 infant mortality, 1 in 5 maternal mortality, 1 in 4 infant stunting, and so on. So these are challenges that can be solved with the help of such a center, with global collaboration, and the focus, as was rightly pointed out, on how do you leverage technology for being affordable, accessible, available technology and advanced technology for the benefits of increased access to healthcare. How do you leverage new business models in being able to make it more affordable and more accessible? And how do you leverage the data that you're collecting across with tools such as artificial intelligence tools or IoT sensor technologies to collect relevant data and apply it in the innovation of healthcare and medicine? Or how do you improve protocols and processes that you mentioned, because there is so much to do on process innovation and service innovation. These are some of the challenges that we are looking forward to working with the India-Sweden Healthcare Innovation Center, and we are very proud to be associated with it. We look forward to also learning and implementing very many of the innovations that you are creating for the benefit of India and for the benefit of the world. Thank you for the opportunity.
Thank you, Mr. Ramanan. Thank you. I'd now like to invite our partners at NASSCOM, represented this evening by Mr. Sanjeev Malhotra, CEO, NASSCOM Center of Excellence, to say a short few words.
No, thank you so much, and congratulations to all to the Business Sweden and all the dignitaries who are present here, contributing into such a great initiative. I think healthcare has never been more important than now. We at NASSCOM, we have been championing innovation and startup programs for the last 5 years. In fact, probably started in our center in Bangalore about 5-6 years ago. And now, in the last couple of years, we have focused more on the emerging technologies and its application in different verticals, and healthcare being one of the top one. And we are committed to supporting this initiative with the state-of-the-art or the best of the startup solutions, the mentors from our network, and the incubation center at Bangalore and other parts of the country, and any other contribution that is needed from our side. We are more than committed to doing that with you and your other partners, and AstraZeneca has been pretty much at the forefront of supporting it. So look forward to working with all of you and with the AIIMS Institute at Jodhpur and Delhi both, and Ministry of Health. So look forward to working with all of you, and you can count on our support in every aspect and every way. Thank you.
Thank you, Mr. Malhotra. Moving ahead, I'd like to invite our knowledge partner, represented by Mr. Gagandeep Singh, MD AstraZeneca, to say a few words as highlighting the need of innovation in this current global new world in healthcare.
Thank you, Amrit. It's an honor to be here today, this evening, and on behalf of AstraZeneca, a science-led biopharmaceutical organization and a knowledge partner to India-Sweden Healthcare Innovation Center, to be part of this virtual launch of Innovation Challenge of India. As we're all aware, the massive advancement of digital technology is disrupting industry. This disruption is unprecedented in its scale and speed effects, and altering the ways in which both healthcare providers and patients deliver, receive, and pay for healthcare as well. Couple of examples are the cloud-based electronic patients records, or technology is making healthcare more accessible with AI-based diagnosis as well as IoT. Or we also see the big data and AI usage going mainstream and allowing for synthesis of medical information too. And at AstraZeneca, we're at forefront of all the three pillars of technology that I just listed out. And today we achieve another milestone by way of launching the Innovation Challenge and the center's website. The Innovation Challenge is an opportunity for startups, as Ramana said, to collaborate with partners on the Innovation Center platform and help, more importantly, solve some of the unmet needs in the healthcare delivery landscape of our country. Our collaboration in the previous edition with Business Sweden, led to great solutions that we are mentoring today. Notably, Predible Health was one of the examples that I wanted to quote. Apart from this, we've also partnered in the past with NASSCOM and have looked at the various models that AstraZeneca runs across the countries, including our digital solutions out of Sweden or other countries where we are setting up healthcare and innovation hubs. I would like to take this opportunity to thank all our collaborators today and wish for the success of this challenge. I must compliment the work of Swedish Trade Commissioner's Office here, Andrews Wigberg, Nicholas Johansson, as well as Amrit and Shubhang. Thank you for all the efforts in spite of these challenging times, the way you've really taken this across. And it wouldn't have been possible without the support that we are getting out of Dr. Sandeep Mishra and Dr. Randeep Guleria's office as well, and your teams as well. A big, big thank you to you. And also to the honorable secretaries present today. Thank you for gracing this occasion. Means a lot to all of us here. Eventually, I'd like to say, that at AstraZeneca, we are ready to help and drive the ambitions forward on this great platform. Thank you.
Thank you, Gagan. Absolutely a great teamwork here. This collaboration, as mentioned, is a tripartite setup with two very important apex healthcare institutes, the All India Institute of Medical Sciences in Delhi and the All India Institute of Medical Science in Jodhpur. I'd now like to invite Director Dr. Randeep Guleria from AIIMS Delhi to address the gathering.
Thank you very much. Shri Rajesh Bhushan ji, Secretary, Ministry of Health and Family Welfare, Dr. Balram Bhargav, DHR and DG ICMR, Dr. Sanjeev Mishra, Director AIIMS Jodhpur, all the other dignitaries on this virtual launch of the website and Innovation Challenge. it's indeed a pleasure, and we at AIIMS are delighted to be the core partners of this India-Sweden Healthcare Innovation Center. This started last year in December with the visit of the King and Queen of Sweden, and we have made great progress as far as this is concerned. And I think this is something that is really required. The world today is facing new challenges. This is a challenging time because of COVID-19. And this is a time when we need to look at smarter and more efficient ways to deliver healthcare, considering the challenges that we are facing. And innovations in technology, I think, is the solution as far as this is concerned. And the challenge that we have as far as India is concerned is to look at frugal innovations, see how we can have cost-effective and efficient ways of healthcare delivery, and being able to do it keeping the pandemic in mind. Also, there is a need which has come out very well as far as the globe is concerned, or the world is concerned, that interdisciplinary, or cross-country collaboration is the mantra when it comes to really progress, especially with COVID-19. And I think this is what the India-Sweden partnership or healthcare innovation is doing. And therefore, this is just the beginning of a long-standing partnership. And I know that Sweden is well known for its innovation. And I think, therefore, there is a huge opportunity for this partnership to grow in various areas as far as innovation is concerned. And as we get more and more partners on board, I think we can see a lot of newer and exciting things happening in this innovation space. So I'd like to just finish here by congratulating everyone. And I hope that this will lead to a long sustainable partnership. Thank you very much.
Thank you, Dr. Guleria, to kind of lay out your vision for our collaboration. Thank you. I'd now like to invite Dr. Sanjeev Mishra, Director, AIIMS Jodhpur, to say a few words.
Good evening, Mr. Rajesh Bhushan, Secretary, Ministry of Health, Government of India, Mr. Gautam Bhattacharya from the Embassy of Sweden, Professor Balram Bhargav, DG ICMR, Professor Guleria, Mr. Nicholas Jacobson, Mr. Agarwal, and Mr. Sunil Sharma, and all the other dignitaries. On behalf of the All India Institute of Medical Sciences, Jodhpur, we would like to first thank the Ministry of Health and Family Welfare, Government of India, for having AIIMS Jodhpur as one of the core partners in this program. And we all know that COVID-19 has shown different opportunities to develop innovative solutions in healthcare. And in these times also with the COVID, with the lockdown and things not working, we have been collaborating with Business Sweden to take things forward. And this initiative of joining hands of the medical institutions, business partners, and entrepreneurs to develop, innovate, and incubate ideas for better solutions and sustainable outcomes. I'm sure this collaboration is going to ensure that this happens. And with the launch of this India-Sweden Innovation website and the Innovation Challenge, I'm sure that this will take this program and this collaboration and working to the next level. And I'm sure that all of us working together would be able to contribute in more than one ways to answer a lot of solutions to the problems which are there in the country, and will definitely make an impact on the public health in the country. And again, from behalf of AIIMS Jodhpur, congratulations to all for all the hard work which has been put in to see this day of launching of the website. Thank you.
Thank you, Dr. Mishra. Now moving ahead to the launch, the first launch of this evening, we would first launch the Innovation Challenge, and I'd like to invite Professor Dr. Balram Bhargav, DG ICMR, to please be moved onto the screen. I request Professor Balram Bhargav to give us a thumbs up to release the video to launch the first Innovation Challenge of the India Healthcare Innovation Center. Center, the first innovation challenge of the India-Sweden Healthcare Innovation Center. I now request Professor Balram Bhargav to kindly deliver his special address.
Honorable dignitaries from Sweden and from India, friends, colleagues, ladies and gentlemen, it is absolutely a pleasure to be here on this virtual launch of the challenge as well as the Innovation Center. I congratulate the Swedish Trade Commissioner and the directors of All India Institute of Medical Sciences, New Delhi and Jodhpur for bringing out this incubation center. And I'm sure with the guidance and the genetically endowed innovativeness of Indians and the guidance from Sweden, and with players like AstraZeneca on the field, I think the sky is the limit in terms of innovation. My earnest request would be that the innovations which are going to be broadly in the areas of processes, technology, and business models, that they remain as what we call Gandhian innovation, because there is a very clear and a very thin line between need and greed. And I hope when we talk of innovation, particularly when the world is grappling with the cost of healthcare, we need to do innovations which are cost effective and are genuinely needed. We need to be, we realize that although our GDP is healthcare expenditure in India is gradually going to be increased to 2.5% by 2025, we are still short of many Western countries, where United States, where it's 19% of a $19 trillion economy. I think in Sweden, it's about 9%, 8 to 9% of their economy. So we are still far away, but therefore, that genetically endowed mindset of being cost effective still remains with us. And we want that to be leveraged for innovations which are cost effective, low cost, and are beneficial to society at large. And I'm sure that this challenge will be of will be tremendous benefit and serve the society in every which way. And I wish it all the best of luck, and I declare it open today. Thank you so much.
Thank you, Professor Bhargav. Thank you both for highlighting the strengths on the Indian side, and we also thank the entire team at ICMR, including Dr. Mukesh, for the support and guidance from ICMR. We now move ahead to the launch of the website. In order to launch the website, I request our chief guest, Mr. Rajesh Bhushan, Secretary, Ministry of Health, to please instruct to launch the website.
Thank you, Amrit. So instructed.
you, sir, for declaring and launching the website live starting today. I now request Mr. Gautam Bhattacharya, Charles d'Affaires and Deputy Head of the Embassy of Sweden in New Delhi, to say a few words on the occasion of this launch.
Thank you very much, Amrit. I hope I'm audible to the audience. Secretary Bhushan, Professor Bhargava, Dr. Guleria, Dr. Mishra, Joint Secretaries, doctors, dignitaries, friends from Sweden and India. It's a great honor to be here. I'm both humbled and excited to be part of this event. I would say humbled because in front of me, I have some of the people who are facing the worst pandemic the world has seen. And you're taking time out for this. This in itself is a proof how important this collaboration is between Sweden and India. And much has been said already by friends before this evening. But let me just say that from the government of Sweden, from the Prime Minister, from the Health Minister in Sweden, we have an absolute priority to pursue this track between India and Sweden. We will definitely have priority for any effort that we put into this field. Therefore, I'm extremely happy to see that the Innovation Center has kicked off with this challenge at the website. This will really be an impetus for the startups and for the collaborations to come. So I, as a diplomat, you tend to see a lot of, let's put it, less than live collaborations, more words than action. But in this field, and I've been following it for many years, this field I can really see concrete steps being taken. And kudos to all of you who have participated in this great joint effort. I would like to say also to the three new partners, to Invest India, to NASSCOM, to Atal Innovation Mission. We worked with you very closely in the past, and I really think that you really will add a lot to this effort. So thank you for coming on board. There's also one thing that I'd like to say is that the Trade Commissioner's Office, Amrit and Shubhang, I know you've been working very hard. It's behind the scenes work, it's slogging for long hours. So I'd like to take this short minute and really thank you for taking this effort and making it all happen. I'd also mention from our side, from the embassy, Yasmin Zaveri Roy. Yasmin, you can come aboard and wave. She's our coordinator for health issues. I'd like you all to see her, again, behind the scenes, but pulling a lot of the strings. So Yasmin, this is something for us to follow up. So with these few words, I'd just like to say that from the embassy side and from Team Sweden, we have AstraZeneca, we have a large number of companies and institutions that are ready to collaborate with India. We have done it for 10 years. We are ready to do it further. And I really want to say that this evening will be a memorable kickoff. So thank you very much, and over now to Secretary Bhushan.
Thank you, Gautam, for highlighting the commitment of Sweden in this collaboration. And definitely, we're very appreciative of the ambassador, yourself, and Yasmin's support on behalf of all the entire core committee at the India-Sweden Innovation Center. Thank you. I now would like to invite our chief guest, Dr. Rajesh Bhushan, to deliver the inaugural address.
Let me begin by extending my greetings to the distinguished members from the Swedish side, Mr. Nicholas Jacobson, Deputy DG and Head of Division for EU and International Affairs, Ministry of Health and Social Affairs, Government of Sweden, Mr. Gautam Bhattacharya, Charge d'Affaires and Deputy Head of Mission, Embassy of Sweden in India, Mr. Anders Wigberg, Swedish Trade Commissioner to India, and his team. Let me also place on record my greetings to the distinguished members from the Indian side, Professor Balram Bhargav, Secretary DHR and DG ICMR, Professor Randeep Guleria, Director AIIMS New Delhi, Dr. Sanjeev Mishra, Director AIIMS Jodhpur, my colleagues in the ministry, Sunil and Lav, who are joint secretaries and have worked tirelessly for this collaborative effort. I also acknowledge the knowledge partner, Managing Director of AstraZeneca India, Gagandeep Singh. Dear friends, I thank the India-Sweden Healthcare Innovation Center for organizing this important meeting of the virtual launch of the website as well as the Innovation Challenge today. I would like to compliment and congratulate on this occasion the Government of Sweden and the Government of India on what is now more than a decade old mutually fruitful and beneficial partnership. This partnership, as some of us know, began with the signing of a MOU in the field of healthcare and public health in 2009. As you're all aware that this MOU, another MOU in fact, was signed in December 2019 to set up a India-Sweden Healthcare Innovation Center in collaboration between the Swedish Trade Commissioner's Office and All India Institute of Medical Sciences, New Delhi, as well as AIIMS Jodhpur. And it's a matter of great satisfaction that the beginnings which were laid down by that MOU are now bearing fruit. As per the MOU, the India-Sweden Healthcare Innovation Center, which is a tripartite collaboration, has been envisioned to provide a platform for developing an ecosystem of open innovation that startups and healthcare delivery stakeholders can utilize. And they can utilize it to collaborate among themselves and to address current and future challenges in the healthcare sector in India. While addressing these challenges, it is extremely important, as Professor Balram Bhargav had just underlined, that we facilitate cost-effective solutions or frugal innovation. We in India have a term for it. We call it jugaad. So which captures beautifully what frugal innovation means. I hope that this platform will enable development and scale up of solutions through this frugal innovation for affordable and accessible healthcare in line with the broader objectives of Government of India. It is also expected that the existing platform would also act as an institutionalized mechanism to promote Make in India vision of our Honorable Prime Minister. Colleagues, on this occasion, I also want to underline the fact that this Healthcare Innovation Center will operate on a quadruple helix model with active participation of government, academia, private enterprise and civil society. So these are the elements of the quad to obtain maximum gains from this collaborative endeavor. We hope that the key components of this center to drive innovation, namely innovation challenges, incubation, mentorship, life center of excellence, skilling, global reach, digital showroom, and other accessories will encourage inclusive participation. Inclusive participation is important. We want innovators from all walks of life to use this platform so as to channelize their efforts to a well-defined, output-oriented endeavor. I would also like to highlight here that AIIMS Jodhpur, AIIMS Delhi and ICMR Delhi are already working on multiple collaborative projects with innovation as the theme to enable delivery of cost-effective healthcare services for the common citizens of India. Invest India, Atal Innovation Mission, NASSCOM and AstraZeneca, they are also coming together with their knowledge and know-how to help in building this ecosystem and sustaining this ecosystem. In today's healthcare, there are multiple challenges that we face. Therefore, innovations can play a large role to improve healthcare across the world, including our country. We all know how the current global pandemic has made the world relook at the importance of public health sector and the need for customizing it to address these new and evolving challenges. We are happy that some of our apex institutions, which are represented by AIIMS Delhi, AIIMS Jodhpur and ICMR, are partnering in this exercise. They have deep and vast expertise, and I'm sure that this initiative will be mutually beneficial to all of us. Today, moving forward, I am indeed very happy and satisfied to launch the website of the India-Sweden Health Innovation Center, and I hope that all these multiple initiatives that we have launched jointly will strengthen the bilateral relationship between India and Sweden. And therefore, I would like to end by congratulating all who have partnered together to make this a successful occasion. Once again, I thank you all.
Thank you, Secretary Bhushan, for those words and for emphasizing the vision that we have set out for affordable, accessible healthcare, which is outcome-based. I'm sure we will move the wheels towards that. Thank you. I would now like to invite Dr. Meenu Bajpai, HOD, Pediatric Surgery, and in charge of international cooperation at AIIMS Delhi, who's been an important partner for us at AIIMS Delhi to deliver the closing remarks.
Thank you, Amrit. Good evening, everybody. India-Sweden Healthcare Innovation Center is a very unique center and one of the collaborations which AIIMS have. As you know, the AIIMS brand of institutions in India stand for the Trinity of Mission, which is education and training, research, and patient care. And as Dr. Guleria pointed out, and I must tell you that since the time Dr. Guleria took over as director 3 years ago, we have had several collaborations and MOUs from universities in the UK, like University College of London, Emory in the US, all the 5 universities in Australia, Cologne in Germany, Japan, and Taiwan, and so many of them. But this particular collaboration stands out in a very unique way. As Shri Rajesh Bhushan ji just mentioned about it, it would help in customizing the innovations that we together try to do. Institutes like AIIMS in India, their core work is the PhD researchers, the clinics in the hospital, they are all now being connected through entrepreneurs and startups to stakeholders, to the international market by very productive inputs from this innovation hub, which the partnership has created. And as there is through a lot of things, through mentorship, through workshops, through funding connections to the international market and to the various stakeholders. So you look at it, these were never in the horizon once upon a time. It looks like as both our directors and Professor Bhargav, who is our own faculty now as a DG there, would understand that these things were never part of our mandate. But I think the pages are turning and we are looking at a different paradigm which this particular collaboration is created. So we look forward to something very productive. And I would like to thank at this juncture our chief guest, Shri Rajesh Bhushan ji, and also welcome him in occupying the most coveted chair as Health Secretary, our special guest, Dr. Balram Bhargava, the 2 joint secretaries, Mr. Agarwal and Mr. Sharma, our directors of AIIMS, Professor Guleria and Professor Sanjeev Sharma. And I'd like to thank Mr. Anders Wigberg as well as Mr. Nicholson Jacobson to kind of catalyze all the processes which have happened so far. You can imagine that last year in November itself, we first met from the Trade Commissioner's office in December, and within a month's time, Her Majesty the Queen had come to visit AIIMS and other parts of the country. And COVID notwithstanding, it could only delay the process of launching by a few months, but it couldn't hold it for very long. And this launch has taken the light of the day. And therefore, most of all, I would like to thank the partners, the NASSCOM, the Invest India, the AstraZeneca, the 3 Indian sort of hubs, notably the Atal Innovative Mission and the other 2 also. And of course, as acknowledged by all the people, including Mr. Bhattacharya so eloquently about Yasmin ji, Shubham and Amrit, who have not only worked as the catalyst, but also as engines. So thank you all of you and to be part of this collaboration so that we look forward to something very fruitful in the coming months. Thank you so much.
Yeah. Thank you, Dr. Bajpai. I'd like to thank all our distinguished guests for taking time this evening to attend. I'd also like to thank all the participants who are with us on the YouTube Live for showing interest and being part of this evening's launch. Thank you. Wish you a healthy and a wonderful year ahead. Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Thank you. Thank you very much.
Thank you.
Thank you.